Diabetic gastroparesis. How to diagnose? The diabetic gastroparesis, before we diagnose a gastroparesis, it is important that we should rule out an ulcer disease which is causing the same symptoms as diabetic gastroparesis. That means an individual can have the postprandial fullness, uneasiness after eating a small meals, and vomitings, etc. But these are the common symptoms which we see in those individuals who have an ulcer disease, that is peptic ulcer disease. Before we diagnose the diabetic gastroparesis, it is important to rule out an ulcer disease and its complications. But a diabetic individual who is little elderly aged, so in them it is to rule out some other organic causes which can give rise to similar symptoms like a gastric ulcer or a gastric cancer, etc. That means before we diagnose the diabetic gastroparesis, it is important for us to do an upper GI endoscopy to rule out a peptic ulcer or any other malignancy of a stomach, particularly in those individuals who are little elderly aged. Once we say that there is no organic cause to explain his symptoms, who is a diabetic, it is important for us to demonstrate that it is because of demonstrate the delayed gastric emptying, which is the common pathophysiological mechanism of the diabetic gastroparesis, which gives the above symptoms. So to demonstrate the delayed gastroempties, many of the times we go for the barium meal, which is commonly done X-ray test, where the delayed gastric emptying which is visualized, but more specifically a gastric scintigraphy, a radionuclide test which can give the diagnosis is the earlier stages. So by endoscopy and the radiological and also the radionuclide studies, the most often we can come to a diagnosis of a diabetic gastroparesis if he doesn't have, a diabetic individual doesn't have any other organic disease. Thank you.